Well, I think what people mean by hospital to home is the virtual wards program. And people got very confused about the difference between remote monitoring and virtual wards. And somehow or other, NHS England got very caught up on the virtual wards idea, when really the biggest value of remote monitoring is in the remote monitoring of long-term conditions. So if you take the virtual wards hospital to home or the virtual wards program, what we're saying there is that patients are ready to go home but need to be monitored, and they could be discharged earlier than they can be without a remote monitoring solution. Now, that's kind of okay, and that's good. And if you can, obviously, if you can release a bed 5 or maybe 10 days earlier, that's fine. But in order to do that, you've got to set the remote monitoring up with the patient. You've got to issue them with equipment so they can monitor themselves. You've got to enroll them in the program, and then 10 days later or whatever, you roll them off the program again. So there's quite a lot of administrative cost involved in running a virtual ward program in that way. I think that the main difference between that and the remote patient monitoring for patients with long-term conditions is that there you are issuing the patients, enrolling them into the program, and they're often on the program for a year, 2 years, sometimes forever. So you can step patients up and down through different areas of remote care or different levels of remote care. And cost of running the patient is much lower because you only issue the equipment once, because you only have to teach the patient how to use it once, and from there onwards, you're making an impact on their care over the full period of their enrolment.